Hey, Mr. Secretary, thanks for coming in. First, just a statement. CMS is working with Louisiana to approve Medicaid provider tax preprints after passing the Working Families Tax Cut Act. We have one more to be approved, the Physician 2026 preprint. Louisiana's fiscal year starts in 2 months, and we just need to get this done ASAP, as was congressional intent. Please prioritize getting it resolved, and I'll follow up with you and Dr. Oz, but critical to my state's providers and to my state's fiscal health, if you will, that this be complied with. So,
I'm happy to meet with you, or I'm happy to put my staff in touch. You can call me anytime to make sure it's happening.
Thank you, sir. Next. Affordable health care. My gosh, when I'm on the campaign trail, for example, or just speaking to folks back home, it's all about that. We have expanded access to health savings account. Now, I'm not clear, though, particularly on the exchanges. So a bronze plan is now eligible for an HSA as an example. How is the department alerting folks, enrollees, that this HSA opportunity exists?
I'm aware of the opportunity. I do not know whether there is an advertising campaign or what. I will check on that for you, Senator.
Thank you. The Biden administration...
the Trump administration is absolutely committed to increasing access to HSAs and to direct primary care and to the catastrophic plans. And so we'll do everything in our power to make sure that that is known.
Sounds great.
An opportunity is known.
Staying on the exchanges, there was a lot of fraud with zero premium policies in the ACA. People paying hundreds of millions of dollars in fines for doing this. I'm not seeing additional funding to address that fraud in your 2027 budget. And yet I recently had an insurance broker told me she is still seeing folks fraudulently enrolled in the ACA marketplace. So the problem continues, even though there's now a greater awareness. Going back to your budget, there was not dollars that I saw to address ACA fraud. Any comment on that?
Well, the President's Marketplace Integrity Rule eliminates the zero premium plans. Those plans were particularly subject to fraud. We think there were 4.4 million people on them who, many of them who didn't even know they were registered because there was broker fraud. People were getting names, signing people up, and collecting the commission for signing people up who didn't know they were signed up. There were, I think, only 40% of the people on it ever made a claim, which indicates
except all that.
Yeah.
So, but it appears that the problem persists. And so I'm being told by folks involved, but the budget, as we see it, does not have money to go after that. And so how is knowing that we've already done good work, what are we doing prospectively to attempt to address the continued threat and perhaps reality of fraud in the marketplace?
I mean, we're using now AI throughout the department to detect fraud, and we're using it very aggressively. We have the best people in Silicon Valley who are now designing the systems.
Now, is that on the Medicare, Medicaid program?
For Medicare let out the door, but I think, we're relying on the Marketplace Integrity Rule to eliminate a lot of the opportunities for fraud in the ACA.
Okay, we may follow up with you on that just for clarity.
Okay.
Next, on Medicare Advantage. We know Medicare is going insolvent soon. We want to protect the 72-year-old retiree in Jefferson Parish, for example. Your department has banned the use of unlinked chart reviews, a little technical, but you and I know what we're talking about. But in the latest MA rate notice, HHS is continuing to use 2018 diagnoses and 2019 expenditure data, not 2023 diagnoses and 2024 expenditure data. Why would CMS not use the more recent numbers, which gives more precision as regards what the expenditure, what the payment should actually be?
Well, I can't answer that question. The guy who can is behind me, Chris Klump. But we're happy to talk to you about it. We know we went through a lot of effort to end the delinking of chart reviews with the with payments to end the upcoding fraud, which was the biggest opportunity for fraud throughout the system. So I don't know why we got the year, why we're not doing it, back to it, doing it to 2023 and 2024, but I will find out for you.
Sounds great. With that, I yield. Thank you, sir.
Support journalism you trust. Support PBS News. Donate now, or even better, start a monthly contribution today.